All right. The time is 2 o'clock. Welcome to the May 14th meeting of the Committee on Health, Equity, Human Needs, and Strategic Planning. The meeting will come to order. We are here in room 203R at the Milwaukee County Courthouse. Any members of the public who want to testify before the committee may do so by either filling out one of these blue comment cards. We've got those in the back. Or folks can visit milwaukee.gov/public comment and follow the instructions provided there. You'll be invited to join us via Microsoft Teams virtually. The public is also welcome to submit written e-comments via the County Legislative Information Center. That's our website. If you just type in Milwaukee County Legislative Information Center, you'll be able to find it. Without further ado, we can call the roll.
Supervisors Gomez Tom.
Here.
Martin. Present. Vincent. Round.
Excused for now. She's on a field trip and she wants to know everybody to know that she misses us. She's having a lot of fun with a lot of fun kids, doing some fun things. So thank you for her service as ongoing, but she won't be able to join us today.
Roundtree Jr.
Hey.
Mr. Chairman.
Here. Yeah, right?
There are 4 members present. We have a quorum.
All right. So we're going to go a little bit out of order today because we've got some folks that have just different things going on. So I want to begin by reading in items 2 and 3 together.
Item 2 from the County Executive, appointing Carrie Belsky to the Commission on Persons with Disabilities with a term expiring on May 5, 2028. Item 3 from the County Executive, appointing Eleuteria Gonzalez-Daub to the Commission on Persons with Disabilities with a term expiring on May 5, 2028.
Yes, indeed. All right. You want to introduce yourself?
Absolutely.
Where's yours? That's okay.
Good afternoon. My name is Kyle Ashley, Director of Community Outreach for County Executive Crawley's office. Pleasure to be here, Chairperson and committee members. I am here on behalf of the County Exec to appoint a few people today, but we're going to start with Eleuteria Gonzalez-Daub. Ms. Gonzalez-Daub has also has been a contributor significantly as far as volunteer leadership and advocacy experience through her service on special education, leadership, and advocacy committees within Wauwatosa Public Schools, as well as through her work with the Children's Hospital Special Needs Clinic Family Advisory Committee and the Wisconsin Newborn Screening Advisory Committee. Her experience both as an educator and parent representative provides valuable insight into the challenges and opportunities facing individuals with disabilities and their families. Her collaborative approach, dedication to community service, and firsthand experience advocating for inclusive systems and supports makes her well qualified to serve on Milwaukee County's Commission for Persons with Disabilities. Given her extensive community involvement, advocacy experience, and commitment to improving outcomes for individuals with disabilities, I respectfully ask that the Health and Human Needs Committee consider Eleuteria Gonzalez-Daub for confirmation to the Milwaukee County Commission for Persons with Disabilities as appointed by Milwaukee County Executive David Crawley.
Thank you very much. And I see Ms. Gonzalez-Daub online. Good afternoon. If you want to just introduce yourself and say a little bit about why you're interested in joining the committee, that'd be great.
Hi, my name is Eleuteria Gonzalez-Daub, and I am the parent of an adult son who has several disabilities, and I guess I've always just been a part of giving back to the community, and I just want to represent the county as a commissioner and help make a difference.
Thank you. And I also see Ms. Belsky. If you'd like to do the same. Good afternoon.
Good afternoon, and such a pleasure to be here today. I'm Carrie Belsky. I am the Associate Vice President of Home and Community-Based Services for Milwaukee Center for Independence. The last 30 years of my work has been focused on making sure that individuals with disabilities are seen and heard throughout our community, and that they find their place within this world and have every opportunity extended to them that everybody else has. My specialty is around employment, community inclusion, and integration. And so I love what this commission stands for and hope to bring some of my experience and education to this team.
Thank you very much. We'll go to committee questions and comments first, and then we'll go to any public comment in the room and online. But I see Supervisor Martin. Go ahead.
Thank you, Mr. Chairman. I have no questions. I would like to make the motion to recommend for approval.
All right, there's a motion for adoption. Any other committee questions or comments? Vice Chair.
Not at this time. I just want to say thank you for wanting to serve to the both of you. Thank you.
Welcome. All right. Any other committee questions or comments? Seeing and hearing none. I've got 2 comment cards. The first is Deb Falk-Palick. If you'd like to come up to the microphone and just make sure that the light turns on green. That makes it's on. We'll do 2 minutes, and then we'll go to Rebecca, and excuse me if I'm getting this wrong, Rebecca Rabatin. We'll do 2 minutes there. But Deb?
Okay, thank
2
you.
minutes.
Thank you. I'm Deb Falk-Palick. A lot has transpired since the last time I was here, along with another disability commissioner in person and some online. I have volunteered my time and my personal and professional experience to serve Milwaukee County for around 25 years as a commissioner on the Milwaukee County Commission for Persons with Disabilities. I'm here today to speak about the appointments to the commission and information I feel you should know as county supervisors. Per Milwaukee County Ordinance, Chapter 73.03 of Ordinance states, the members of the commission shall be appointed by the county executive with approval by the board. So you are the last step in confirmation of appointments. In January, long-term and highly respected disability commissioner, who is also a county board supervisor, Willie Johnson Jr., made a motion at our public meeting, which was unanimously voted on by the commissioners to move 3 names forward to the county executive for recommendation for membership. On March 19th, I was contacted by a member of the county executive office to inform us that 1 name would not be moving forward, with the reason given that County Executive Crawley has concerns about this individual's alignment with Milwaukee County's mission and vision. This was really stunning to hear, as we had all unanimously voted to move this person's name forward. This individual is seen as one of the foremost experts by colleagues around the state of Wisconsin in the Americans with Disabilities Act. This individual was appointed by Governor Evers to serve the entire state of Wisconsin on the Governor's Committee for Persons with Disabilities. It's beyond perplexing that somehow this person is good for all counties in the state, but not seen that way for Milwaukee County. It really is a gift that this person volunteered to serve and apply. I sent an email to the county executive on March 22nd and copied all county supervisors, DHHS staff members, Shakita LeGrant McLean, Tina Anderson, Jacqueline Fermanic, and county executive staff Mary Jo Myers and Kyle Ashley. I asked the county executive if he would meet with our commission to help us understand how an individual does not align with the mission and vision of the county. I also asked the county executive if he would be willing to speak directly with this person that we all voted unanimously to move forward to him. Direct engagement with an individual ensures information is not just gathered from secondhand information sources, it also ensures fairness and reinforces that decisions are being made where the full picture about a person is present before judgment is made about them. To date, there has been no response from the county executive to meet with our commission and in particular this individual. Everyone on the commission is fully aware, I can't underscore this enough, that the county executive has statutory appointment authority with board approval.
That's 2 minutes. I'll give you an extra 30 seconds.
Oh, thank you,
Yep.
Supervisor Rowan. Okay, fast forward a couple of weeks to what happened in the Behavioral Health Board, and there were some deja vu moments. I think it does need to be looked at. There were 2 directors in the disability office that have departed. I believe you need to look into that. I was also stunned to hear the same information being told to the Mental Health Board about mission and vision as was told to the Disability Commission. I've requested more than once meetings with the commission as a whole, with county executive staff and DHHS staff, and those requests have gone unanswered. I feel that my ask of you is to help ensure there's a transparent process as to what happens for new appointments, reappointments, and education on mission and vision. It is damaging for any community member who volunteers to come forward to be told they don't align with a mission and vision. And I feel there needs to be education. And I look forward to a meeting with my county supervisor to explain more information.
That sounds good.
Thank you so much.
Thank you. Rebecca? Nope, you're all set? Okay. Okay. Any other comments, either here or online? We have a motion to approve Ms. Belsky and Ms. Gonzalez-Doby. Seeing and hearing no other requests to comment, we can call the roll.
On the motion by Supervisor Martin that item numbers 2 and 3 be recommended for confirmation, Supervisor Gomez-Tom?
Aye.
Martin?
Aye.
Roundtree Jr.?
Aye.
Mr. Chairman?
Aye.
4 ayes, 0 noes, the motion prevails.
Thank you. All right, I know our housing administrator is at the airport about to board a plane, and he wants to be able to speak to the items that are related to the housing committee. So why don't we read in items 5 through 8?
Item 5 from the County Executive, appointing Colleen Foley to the Counties and Cities Housing Committee. Item 6 from the County Executive, appointing Nancy Estevez to the Counties and Cities Housing Committee. Item 7 from the County Executive, appointing Wendy Weckler to the Counties and Cities Housing Committee. Item 8 from the County Executive, appointing Anthony Casey to the Counties and Cities Housing Committee.
Welcome. Do you want to introduce yourself again?
Good afternoon again, Chairperson. Kyle Ashley, Director of Community Outreach for County Executive Crawley's office. I do want to mention and apologize to Carrie. I did not get an opportunity to read her bio out, so just want to say that and thank you for your willingness to serve on OPD. But I do have a number of bios to read if appropriate for our Housing Committee folks. And I'll start with Ms. Colleen Foley. Colleen Foley brings decades of legal, executive, and public sector leadership experience that makes her exceptionally well qualified to serve on the Milwaukee County Cities and Counties Housing Committee. As Executive Director of the Legal Aid Society of Milwaukee, Ms. Foley oversees a major public interest law organization dedicated to advancing access to justice and serving vulnerable populations through the community. Her leadership includes operational oversight, strategic planning, fiscal management, and collaboration with community, legal, and government stakeholders. Ms. Foley has been deeply involved in housing stability and eviction prevention efforts throughout Milwaukee County, including leadership and collaboration related to eviction-free MKE and housing access initiatives. Her work has focused on addressing barriers to stable housing, supporting tenants and families in crisis, and advancing equitable solutions that strengthen communities. Given her extensive expertise in housing advocacy, legal leadership, and public service, I respectfully ask that the Health and Human Needs Committee consider Colleen Foley for confirmation to the Milwaukee County Cities and Counties Housing Committee as appointed by Milwaukee County Executive David Crawley. I'll go next to Ms. Estevez. Nancy Estevez brings more than 20 years of leadership experience in homelessness services, housing systems coordination, data management, and community-based program administration. As HMIS manager for the Institute for Community Alliances, Ms. Estevez oversees system operations supporting more than 300 users across Milwaukee's Continuum of Care network and plays a critical leadership role in coordinating housing and homelessness response efforts throughout the community. Her expertise includes overseeing HUD compliance and reporting, coordinated data-driven housing initiatives, leading community-wide point-in-time counts, managing coordinated entry operations, and strengthening partnerships among housing providers, government agencies, and community stakeholders. Given her extensive experience in housing systems management, homelessness prevention, community collaboration, and public service, I respectfully ask that the Health and Human Needs Committee consider Nancy Estevez for confirmation to the Milwaukee County Cities and Housing Committee as appointed by Milwaukee County Executive David Crawley. The next person on our list is Ms. Wendy Weckler. Wendy brings 25 years of leadership experience in Milwaukee's homeless services system, including more than a decade as executive director of Hope House Milwaukee. In this role, she has demonstrated strong executive leadership in organizational management, strategic planning, fundraising, HUD compliance, and collaboration with the Milwaukee Continuum of Care to advance system-wide efforts to address and prevent homelessness. Ms. Weckler has led significant organizational growth and transformation, including expanding budgets, securing major grant funding, and overseeing the acquisition and integration of housing resources to expand service capacity for individuals and families experiencing homelessness. Her work is focused on strengthening housing stability systems, improving program coordination, and ensuring high-quality, equity-centered service delivery across multiple programs and funding streams. Given her extensive experience in homelessness services, housing system leadership, and community community collaboration, I respectfully ask that the Health and Human Needs Committee consider Wendy Weckler for confirmation to the Milwaukee County Cities and Counties Housing Committee as appointed by Milwaukee County Executive David Crawley. And last but not least, Mr. Anthony Casey. Anthony Casey brings over a decade of experience in construction management, real estate development, and community-focused housing solutions with a strong track record of advancing projects that address social determinants of health and strengthening neighborhoods. As principal of KG Development Group, he leads real estate development initiatives focused on creating sustainable, supportive housing and mixed-use projects that expand access to stable, affordable living environments. His expertise spans all phases of development and construction, including project management, budgeting, estimating, compliance with building codes, stakeholder coordination, and financing tools such as low-income housing, tax credits, and historical tax credits. He also holds specialized certifications in supportive housing development and rental housing finance, equipping him with strong technical knowledge of housing systems and funding structures. Given his extensive experience in housing development, community investment, and collaborative leadership across public and private sectors, I respectfully ask that the Health and Human Needs Committee consider Anthony Casey for confirmation to the Milwaukee County Cities and Counties Housing Committee as appointed by Milwaukee County Executive David Crawley. Thank you.
Thank you very much. All right, let's go to Ms. Foley. I think I see you online. If you'd like to introduce yourself and explain what, I know you, so I can imagine what brings you to the Housing Committee, but if you'd like to share your own words, that'd be great.
Yeah, so thank you, Chairman. Colleen Foley, Executive Director, Legal Aid Society. And it would be an honor to be on this committee. Legal Aid does a lot of work around housing stability and recognizing that it's the key to success in nearly every facet of a family's life. And I'm also really honored to be considered, particularly with the other candidates. So I'm glad to answer any questions, but thank you for your consideration. It's a really important committee to be involved in.
Thank you very much. Ms. Estevez.
Good afternoon, everyone. It is a privilege to be here and serving our community. As you know, I work in the homeless services, overseeing coordinated entry, making sure that there are no barriers to getting into housing. And so it is such a joy to know that the city and county, in partnership with one another, are looking to making sure that those that are experiencing issues with housing in the housing sector, whether they are unhoused, those that are experiencing domestic violence, trafficking, etc., that we have a standardized way for access into housing and that it's equitable for our community. Thank you.
Thank you very much. Ms. Weckler, I see you online. Go ahead.
Hi, thank you so much, and I appreciate being here. I recently became the director for the Continuum of Care in Milwaukee at United Way, and so I'm super excited to be a part of this committee and be able to bring the homeless system into the wider work of housing for our community. Thank you.
Thank you. And Mr. Casey, good afternoon.
Good afternoon, everyone. It's definitely a pleasure to be here. I'm very grateful, and this has been a good year, and this is icing on the cake so far. So, again, principal of KG Development Group, we focus a lot on social determinants of health, access to economic mobility, access to quality health care, quality foods, neighborhood and physical environment. And the big reason why I'm here today is social capital. So we infuse that in all of our developments, and we want to continue to, work with the Milwaukee County to make sure we're reducing barriers, across the county of Milwaukee and the developments that we partner with the Milwaukee County. So again, I'm just very grateful to be able to be here today, sit in front of you all, hopefully recommended, and looking to join the rest of the committees and members to make, Milwaukee one of the healthiest counties, in the country. So very grateful today.
Thank you very much. Thanks to everybody for your willingness to serve. Administrator Matthew, I don't know if you wanted to jump in now to say anything before you got to hop on a flight.
Thank you, Chairman. Thank you for your flexibility. Good afternoon, committee members. Nothing to add. I was more here just to see if there's any housing-related questions, but I do want to thank the four appointees. As a lot of individuals know, in our community, these four are perfect for this committee, have served our community for years in various facets, and really are tremendous advocates for those we serve. As this committee knows, housing services is very much focused on individuals who have the hardest road to accessing housing. And these four in particular, in their own way, have really helped over the years advocating for those that really have the hardest road to get into housing, and their advocacy means a lot to us. So, Sharon, I'm just here if there's any procedure-related questions, but thank you.
Thank you. Committee, questions or comments for any of the nominees? Supervisor Martin.
Thank you, Mr. Chairman. I do not have any questions, but I do want to say thank you all for your willingness to serve on the counties and cities housing committee, because as we know nationwide, housing stock is just not readily available, and particularly here in Milwaukee County, we know we've been having some successes with housing our folks, but this committee will do some additional work, and hopefully we will bring up our housing stock. Therefore, I move recommendation for approval of all of the appointees.
All right, we have a motion for approval. Any other questions?
Yes.
Go ahead.
Thank you, Mr. Chair. Not a question, more just a comment. I'm very excited to see the committee start to be filled, because I know this is something that's been long anticipated and needed. So I'm just thankful for the folks that are stepping up to be in these positions, and I'm excited and encouraged.
Thank you very much. All right, we'll go to questions in the room. Supervisor O'Connor, saw your hand up if you want to come on up, and then we'll go to any other questions in the room and then questions online.
Hello, thank you, Chairman. Hello, committee members. Ann O'Connor, Supervisor for the 1st District. Prior to my role on the board, you may remember me testifying at this exact table in support of the formation of the City County Housing Committee. So it is exciting to see it finally coming to fruition a few years down the road. I know that Director Matthey seems to be somewhat otherwise engaged, but I guess I did have some questions around process. How many seats do we expect to be able to fill in addition to the ones being appointed today? And when do we expect the first meeting to take place? So I guess any kind of time horizon would be useful. And also if there could be any comment provided on the stakeholder engagement. If you probably remember when we had testimony in this room years ago, it was pretty much a packed house with a lot of people really caring about this issue. A lot of inquiries over the past couple of years as to when this was going to happen. And so I guess I was a little surprised to just see it suddenly on the agenda with not a lot of lead up to that point. So again, I guess the questions are remaining seats to be filled, process, engagement with stakeholders, and timeline of convening. Thank you so much.
You bet. I can take part of that, and then Administrator Matthey, if you want to jump in with anything that I missed. But based on the ordinance, the Milwaukee County has 6 appointees that we need to hear and review and affirm, nominated by the county executive. So this before us, there's 4 right before us. Then in a future cycle, we would hear the other 2. The city council, I think the council president is tasked as part of their ordinance to nominate 7 folks that they think would be a good fit based on the specifications of the ordinance. And then there are other folks that are, either the county board chairwoman, there are different housing leadership that are up. Either they will be on the committee or it'll be their designee that will participate. In terms of timing, the committee won't meet until everybody is in, just because it doesn't make sense for, if it's a cities and county housing committee, the whole point of it was to do it together, right? That is a joint committee. So we'll be following up with our friends in the city to make sure that they have their process for nominees advancing, and that we'll have our other 2 nominees coming in the the coming future. Once that's all done, there's like an MOU, I think this is the right word, or acronym, between our county and the city in terms of like how the committee would meet, when it would meet, who would organize the meetings. But until we have all the nominees that are affirmed, we will continue to press. I'm impatient, right, to get this moving too, so I will continue to send more and more and more emails on this to get this done. In terms of the thought about having like an online dashboard where people could apply themselves, we had discussed that just never happened. And in the amount of time that it's taken to like at least just get our nominees up and out, I don't know, I'll take the fall on that. I just made a call to say, let's just start getting nominees heard. And if the public has concerns with anybody based on the specifications, then, let's raise them here in the meeting, right? It's a public meeting. If there's any concerns with any of these four, the next two that will come before us, let's hear those. But my preference is just like again, I'm impatient to get it going, so let's get it going. If there are folks who are interested in, putting their name in a hat, Administrator Matthey or Mr. Ashley, I'm sure, the county executive staff, that's the best way, because the county executive's office is the one that's doing the nominating. So reach out to them and say, I'm interested. But I think that's what I foresee as the path forward, but would love to hear Administrator Matthey, if there's anything I missed on that.
Thank you, Chairman. Not a lot to add. I think I just want to echo the Chairman's sentiment. I think we just were kind of anxious to do our part on the county side to move this forward. And again, there are two additional seats, and it's important to note that we would like and we need one of the next nominees to be somebody with lived experience that is a tenant themselves, that has a history of housing challenges. So that is definitely one of the next nominations we're going to have. And as the Chairman said, we want to just be ready on our side on the county to start this process. And with these nominations, we'll be ready to go on our side, as Chairman mentioned. Still not exactly sure what the city's process is going to look like on their end or their timeline, but we just wanted to move forward on our end. Thank you.
Thank you. Any other questions or comments in the room or online on the topic? Otherwise, we have a motion to adopt all four of our nominees today. Once, twice, sold. We'll call the roll.
On the motion by Supervisor Martin that items 5 through 8 be recommended for confirmation, Supervisor Gomez-Tom?
Aye.
Martin?
Aye.
Roundtree Jr.?
Aye.
Mr. Chairman?
Aye.
4 ayes, 0 noes, the motion prevails.
Congratulations to all of the new appointees. Thank you for your patience as we continue to work on just like getting this going. But best wishes as this unfurls. We'll go back to item number 1.
All right. Good afternoon again. I'm sorry.
Yeah, she just needs to.
Item 1 from the County Executive, appointing Alan Goodman to the Milwaukee County Commission on Aging for a term expiring April 22, 2029.
All right. Good afternoon again, Chairman, committee members. Happy to present Mr. Alan Goodman.
You just introduce yourself one more time.
I'm sorry. My name is Kyle Ashley. I'm the Director of Community Outreach for County Executive Crawley's office, and I'm happy to bring forward Mr. Alan Goodman to be considered for appointment, a confirmation for Commission on Aging. Alan Goodman brings more than 20 years of executive leadership experience in operational excellence, service delivery, governance, and performance improvement across healthcare adjacent services, higher education, financial services, and nonprofit organizations. As a Lean Six Sigma Black Belt and a department chair at Milwaukee Area Technical College, he has demonstrated a strong commitment to improving systems, developing workforce capability, and advancing measurable outcomes through collaboration and accountability. Mr. Goodman's experience leading large-scale operational initiatives, managing cross-functional teams, and serving in community and board leadership roles makes him well qualified to serve on the Milwaukee County Commission on Aging. His work with educational institutions, youth leadership programs, foster care advocacy, and community organization reflects a deep understanding of the needs of diverse populations and a commitment to public service. Given his extensive leadership background, stakeholder engagement engagement experience, and a dedication to community improvement, I respectfully ask that the Health and Human Needs Committee consider Alan Goodman for confirmation to the Commission on Aging as appointed by Milwaukee County Executive David Crawley. Thank you.
Thank you very much. And I see Mr. Goodman online. Good afternoon.
Hey, good afternoon.
If you just want to introduce yourself and explain why you're interested in joining the commission, that'd be great.
Well, thank you very much, and thank you for reading that bio. I didn't realize it was that long, so I appreciate it. Alan Goodman, and I am, I guess I have a really personal reason for wanting to be on the committee, and it really is because over the last 5 years, I've been involved in my parents' well-being. I lost both my mom and my dad in a 2-year span in the last 5 years. My dad to a stroke, and I had to kind of take the lead on maneuvering through the healthcare system, getting him rehabilitation and eventually nursing home when he passed, and then looking after my mother, who unfortunately I lost to a homicide. And so these experiences really have opened my eyes to how invisible our elders have become in society. And I think there's so much more that we can do, not only to support them, but to protect them. And so that is the main reason why I wanted to be on the Committee for Aging. But also I want to use my background in operations to really make a strategic impact on the performance of the committee and what we can get done.
Thank you very much for your willingness to serve. Committee questions or comments for Mr. Goodman? Supervisor Martin. Or Vice Chair.
Thank you.
Gomez Tom.
Thank you, Mr. Chair. I would just like to move for adoption, and thank you for the willingness to serve, sir.
Thank you. Do you want to add anything?
Again, echoing our Vice Chair, thank you for your willingness to serve, and thank you for sharing that personal story in relations to your parents. And I'll continue to send thoughts and prayers of strength and comfort with you as you move forward and do good work with the committee. Thank you so much.
Thank you.
Thank you. Any other questions or comments in the room or online? Let's move for adoption. 3, 2, 1. We can call the roll.
On the motion by Supervisor Gomez-Tom that item number 1 be recommended for confirmation, Supervisor Gomez-Tom?
Aye.
Martin?
Aye.
Roundtree Jr.?
Aye.
Mr. Chairman?
Aye.
4 ayes, 0 noes. The motion prevails.
Thank you again for your willingness to serve. Congratulations.
Thank you.
Let us know how it goes. We'll go on to item 4.
Item 4 from the County Executive, appointing Gabriella Leachman to the Aging and Disability Governance Board with the term expiring on May 5, 2028.
Good afternoon again, Chairman and committee members. It is my privilege and pleasure to bring Ms. Gabby Leachman. Yep.
Sorry.
My name is Kyle Ashley, Director of Community Outreach for County Executive Crawley's office. And it is my pleasure to bring Ms. Gabby Leachman forward to be considered for confirmation to the ADRC Governing Board. Gabby Leachman brings a strong record of community service, advocacy, and direct support experience that reflects a deep commitment to improving the lives of older adults and individuals with disabilities through Milwaukee County. Through her volunteer and professional roles, she has demonstrated compassion, accountability, and a person-centered approach to service. Ms. Leachman currently serves as a volunteer with the Board on Aging and Long-Term Care, where she advocates for residents in long-term care facilities, supports residents' rights, and works to resolve concerns related to care, dignity, and quality of life. Her additional volunteer service with AIRS Senior Network and Wisconsin Department of Health Services IRIS Advisory Committee demonstrates her dedication to supporting seniors, individuals with disabilities, and community-based care systems. Professionally, Ms. Leachman has gained valuable hands-on experience as a direct support professional through the IRIS program, providing individualized support that promotes independence, health, and community inclusion. Her experience working directly with older adults, individuals with disabilities, and families gives her practical insight into the challenges and opportunities facing vulnerable populations within Milwaukee County. Given her advocacy experience, commitment to public service, and passion for advancing person-centered care and inclusion, I respectfully ask the Health and Human Needs Committee to consider Gabby Leachman for confirmation to the Milwaukee County Aging and Disability Governance Board as appointed by Milwaukee County Executive David Crawley. Thank you.
Thank you very much. Impressive auction auctioneer skills as always. Reading fast. Very good. Ms. Leachman, if you want to introduce yourself, the floor is yours.
Yes, hello. My name is Gabby Leachman. I'd just like to say thank you for this honor and for me to be appointed to the ADRC board. I'd just like to say I do have a strong commitment for the older population and individuals with disabilities because for me, I have a personal reason. As my parents are getting much older in age, I understood that they did not understand anything within healthcare, and then there's a language barrier on top of it. And so I understood if they had it, so did other older adults as well. And so I sought out to get within, I guess, the field per se, and wanting to help other individuals because I know a lot of people either lost their children or don't have someone there available to help them. And so that's what I wanted to do and get involved in how and continue to do so.
Thank you very much for your testimony and your willingness to serve. Committee, questions, comments, motions. Supervisor Martin.
Mr. Chairman, thank you for stepping forward and answering the call from the county executive, and I recommend move of adoption.
Thank you very much. Yeah. Any other questions or comments? Any other questions or comments in the room or online? Hearing and seeing none, we can call the roll.
On the motion by Supervisor Martin that item number 4 be recommended for confirmation, Supervisor Gomez-Tom?
Aye.
Martin?
Aye.
Roundtree Jr.?
Aye.
Mr. Chairman?
Aye.
4 ayes, 0 noes, the motion prevails.
Congratulations. Best wishes. Thank you for being here. All right. We will go on to item 9.
Item 9, a resolution by Supervisors O'Connor, Shea, Martinez, Capriolo, Gomez-Tom, Vincent, Rolland, Wasserman, Belinsky, Logston, and Martin, recognizing May 2026 as Amyotrophic Lateral Sclerosis Awareness Month.
Supervisor, floor is yours.
Thank you, Chairman, committee members. Ann O'Connor, committee or County Board Supervisor for District 1. This resolution is recognizing, as was read into the record, Amyotrophic Lateral Sclerosis Awareness Month, which we all probably know better as ALS or even Lou Gehrig's disease. This particular resolution was actually brought to us by some constituents whose personal experiences led them to advocate for this. And I would also like to share that during this process, I learned that many of our own board members have been affected either through personal connections or family relations. Additionally, I have seen over the past couple of years a college friend of mine and her husband, now deceased from the disease, have a very public struggle with ALS. They did it with bravery and courage, a sense of humor, but also appropriate anger and frustration. So as you know, as the County Board of Supervisors, one of the tools available to us is our platform to raise awareness, and that's what this resolution seeks to do. And I would just like to read one of the last clauses. Supervisors encourage residents to learn more about ALS and to support efforts that improve awareness, advocacy, research, and access to care for people living with this disease, which is extremely tragic and terminal, and most patients do not survive once a diagnosis occurs past 2 to 5 years. So it is swift as well. So thank you for considering this and sharing this information should it be adopted. Thank you.
Thank you. Committee, questions, motions, adoption, or motions, yeah. Blah. Vice Chair Gomez-Tom.
Yes, I thank you, Mr. Chair. I would like to thank my colleague for bringing this forward for us. And as a co-sponsor, I would like to move for approval.
All right, it's been moved for adoption. Supervisor Martin.
I have a comment. Thank you to Supervisor O'Connor for leading this recognition. and to all the co-sponsors. I know ALS personally impacted myself and my spouse, Mr. Martin, when a coworker of his was diagnosed with ALS, and to watch that, a vibrant young man to go from being very active to confinement to a wheelchair, then lose the ability to speak, etc. This is something that very much needs to be continued to be in the forefront of our community's mind, but it appears to me that diseases go in cycles. It's cyclical for the heightened awareness. I don't know what we're on now, but ALS seems to have been pushed to the rear shelf. So thank you for bringing this forward again so that we can continue to encourage awareness, and not only awareness, to encourage people to support ongoing research. $5, $10, grassroots donations do an awful lot, and they go an awful long way when we're facing these types of research issues. Thank you again for putting this back on our radar.
Thank you very much. Any other committee questions or comments? Any questions or comments in the room or online? Seeing and hearing none, we can call the roll.
On the motion by Supervisor Gomez-Tom that item number 9 be recommended for adoption, Supervisor Gomez-Tom?
Aye.
Martin?
Aye.
Roundtree Jr.?
Aye.
Mr. Chairman?
Aye.
4 ayes, 0 noes, the motion prevails.
Thank you very much. We can go on to item 10.
Item 10 from the Director, Office of Strategy, Budget, and Performance, providing an informational report on the office's performance and additional information on the annual 2025 report. This item is informational only unless otherwise directed by the committee.
All right. And before you guys get started, I just want to share, if you are a longtime listener and caller, watcher of County Board this meeting, you'll know that I love this next batch of reports. This is the point in time where we start to hear year-end reports from each of our departments. It really gives us on the County Board a sense of like what are the goals, what were the strategies, what were the outcomes that happened over the course of the year. So often our work is like very tactical, like, hey, can we get a couple $1,000s for this and that? This is really the opportunity to have like more of those strategic conversations and questions about outcomes. So I'm very, very excited about this. One other flag, just in a way to try to get us to that Q&A faster. What I'm trying to do this year is to ask each of the presenters to limit their presentations to 5 minutes, knowing that all of us in the county board like already have all of the reports and the PowerPoints and all that. So in my view, we don't need like somebody to reread those reports or PowerPoint presentations to us. Instead, what I'm hoping for is like about 5 minutes of the high points from each group. What are the key things that we should be knowing about? What are the key challenges that we should be knowing about? And then hopefully fostering a conversation amongst us into that nitty-gritty that I think we'll want to talk about. So thank you in advance to the presenters for your willingness to do that a little bit differently this year. We'll see how it goes. Fingers crossed that this can be a lot of fun and engaging. Without further ado, if you guys want to introduce yourself, we can go on to item 10.
Good afternoon, Chair, Supervisors. My name is Isaac Rowlett. I'm the Strategy Director for Milwaukee County in the Office of Strategy, Budget, and Performance.
Good afternoon, Nick Sinram, Acting Director of Strategy, Budget, and Performance.
Okay, so brevity is not my strength. I wrote my remarks in order to keep it to time, and I think I got it to 5 minutes.
It's already 4:30, so you got it.
It's already. I already am done. I'm already done. That KPI has the ship has sailed. Okay, so what is SBP? I think everyone is aware, right? SBP exists to connect strategy, budget, and performance for Milwaukee County. And I want to give you an honest picture, right, to the comments that were made by the chair, both of some of our successes and some of our real challenges, both from last year and now leading into future years. So I'm just going to go right to the results. I'm going to go right to our goals And as was referenced, the PowerPoint file as well as the full report is on file already. Let's start with goal 1. So this is a good news story. Our target in project management was 20 completed projects. We hit 29. So that includes work like migrating new employees to the Wisconsin retirement system, implementing free phone and video calling for people in our correctional facilities, submitting the FEMA flood disaster declaration documentation after the August floods, though I should note, as part of the strategy, budget, and performance office, that we were not fully reimbursed for said submissions. In addition, we secured accreditation for the Community Reintegration Center through the American Correction Association, and the PMO is also, on top of all these projects, carrying out 2 major multi-year efforts, 2 of the largest projects in the county's history. One is the Investing in Justice Courthouse Complex, that there'll be significantly more discussion about in the coming months, and the other is the Future State Project, about which there will similarly be a great deal of discussion in the coming months as well. And those aren't even counted in the 29. So that's goal 1. Goal 2, grant development. Our goal has been a 10% increase year over year. It's an ambitious goal, but an important one because we know the importance of bringing in revenue. We did not hit this goal. Our submissions dropped 24% from 45 to 34. And one of the major reasons for this was that the federal grant landscape has shifted significantly in 2025 under the new administration. Programs were restructured, delayed, or even eliminated altogether. We pursued every eligible opportunity that we found, but the overall pool shrank. And so the dollar value of what we submitted, $107.6 million, still reflects meaningful effort. And as of April 2026, 12 awards have been confirmed, totaling $48.7 million, a 50% success rate on decided proposals. There's another $46 million still pending, and the early 2026 picture is actually better. We've already submitted 17 proposals in the first quarter alone compared to 4 during the same period last year. Goal 3, capital budget. Our goal has been over the years to get to 60% of requested capital projects adopted annually. We are at 35%. Essentially flat from the 33% the year before and well off target. The structural reason is fairly straightforward. The request volume is high. We average about 146 non-airport submissions annually, while our funding capacity supports roughly 55 large individual projects. And things like the IJCC, zoo front entrance, and domes come in obviously significantly higher. So we have worked to direct departments toward critical needs submissions, but departments retain discretion over what they submit, and there's a great deal of need across the departments, let me be clear. And the challenges of our over $1 billion in capital backlog remains very real. So to put it bluntly, we are not going to close this gap. We're not going to make progress on this without either one of 2 things. One is more capital funding, right, and addressing that capital backlog, which is part of why it comes up so often. And then secondly, a fundamental change in just how we manage the pipeline, right? This is a basic supply demand about, for capital dollars. Goal 4. Structural deficit. 2025 projected gap was $11.5 million. The 2026 gap jumped to $46.7 million. The primary driver is $26 million in one-time funding that was available in 2025, which is simply gone, combined with the $13.5 million in salary and benefit increases. The 2027 projection is $50.1 million, driven largely by transit, where costs are rising $6.3 million while federal stimulus funding has run out. Transit alone accounts for about $16 million of that $50 million gap. This trajectory was anticipated. In fact, it was discussed a great deal throughout the Act 12 deliberations in 2023, but simply because it was anticipated doesn't mean that it's comfortable, right? I think we're all painfully aware of what this means in terms of concrete services that we provide to Milwaukee County residents. So the structural problem is just that mandated services without dedicated funding eat about 74% of our tax levy, and statutory revenue caps limit our ability to keep pace with inflation. State support in the past year has helped. Things like the expressway patrol funding that was secured makes a significant difference, and yet it's not sufficient to reverse the overall trend. And I'm going to end with a good news story. Performance measurement. thanks in part to this very committee, and I am genuinely grateful for the executive sponsorship and support, the county has achieved a milestone whereby we now, if for the first time in the county's history, not only have a strategic plan, not only have department plans, not only have scorecards, but we're reporting out in terms of our actual 5 biggest KPIs per department. It's not fully online yet. It's not going to be online until about the fall, but all the information is available. You're going to hear it from all of my colleagues across the county executive's administration. Every single department has participated, not just willingly, but enthusiastically in setting ambitious and real goals that, as you see from ours, we don't always achieve, right? But we want to be as transparent as possible about our progress to date. Best of all, it's built in-house, in all our systems, so it doesn't cost any additional dollars to the county. That's all I have. Thank you for your time. More than happy to address any and all questions.
Thank you very much. Committee, questions or comments? Vice Chair.
Thank you, Mr. Chair, and thank you both for being here and answering our questions. I was just curious with Goal 2, if the number of proposals and competitive grant submissions were impacted directly from like federal grant opportunities no longer being available, and if that was part of the, the significant impact in not making that number.
Chair, Supervisors, Isaac Rowlett, Strategy Director, Office of Strategy Budget Performance. Yes, in short, that was a major contributor to the reduction last year.
Yeah, that was my, I anticipated that being the answer. And in like the full reports, do we recognize kind of like the issues outside of our control and how they impact the results of the goal, just so that we're capturing that for future consideration?
Chair, Supervisors, Isaac Rowlett, SPP, yes, absolutely. We delve into some of the specifics there. And then, as I said, there's still some positive news here, which is the environment seems to be shifting. I don't want to be overly optimistic, but shifting in a more positive direction this year.
Great.
Thank you. Other questions? Any other questions? Okay. I've got a couple.
Supervisor Rowland?
Oh, hey, Supervisor Vincent. Good afternoon.
Hey, I have a little good afternoon, everyone. Beaming in from Phantom Ranch. I just have a few minutes, but I've been listening in. If I could please be marked in attendance and with the majority of the votes taken, I'd appreciate it.
Yes, without objection. It is done. Thank you. Thank you. All right. One sec. All right. I just had a couple questions on just thoughts on, I know we have a whole set of strategies that's rolling around to get our transit system to be more sustainable. So that seems like a lot of the right people looking at that. Efforts are happening. It's going to happen. On the salaries and benefits piece of the puzzle, I don't personally know as much about like what are the conversations, like what is the action plan. I don't know if you feel comfortable talking about that today, but if we're trying to get to a place where we're going to be sustainable, right? That was like one, I don't forget what goal it was, but number 4 maybe? Yeah. So if we're trying to get that back to even, right? Transit's a big part of that, but then the salaries and benefits is obviously a huge part of that. I think probably a lot of us would feel uncomfortable reducing any like benefits that are being provided to employees. Not to like take that off the table completely, but I think a lot of us would have an allergic reaction to that, which really then the question is like, is the count, like the employee count, where we would look to, if it's vacancy and turnover, like increasing that to get to sustainability? Or I guess tell me more about what are we doing and what is the expectation of how to get to sustainable on that piece of it? No, you just got here, so feel free to punt if you just like, I just got here.
Nick Sinram, Acting Director of SBP. Maybe need to punt just a little bit. We're still a little bit early in the process. We're working with department heads to assess all options. There are opportunities around streamlining healthcare plan design, potentially to encourage employees to have more efficient utilization rather than necessarily making drastic changes. So we're looking at all options across all departments. We've not received requests quite yet from departments, but that more will be coming soon, and we do plan to come back with updates to the Finance Committee.
Thank you. I think the only other thing that was in the presentation materials and report that we I know I gave you like a couple minutes, so the fact that additional KPI reports will be coming on like a quarterly basis. I mean, we'll just spend 2 minutes talking about what that'll look like. How, will the board see it? Will the public see it? What will be in those? And when timing wise, we can start to see those things.
Hello, as Chair Supervisors, Isaac Rowlett, Strategy Director, SPP. Yes, happy to talk about that. So the short answer is departments are already reporting out on a quarterly basis on their progress against their key KPIs. And you're going to see those through each of the subsequent presentations from departments within the County Executive's administration. By the fall, which hopefully sooner, but by the fall, I want to be careful about our commitment, that will be fully publicly available on the website for everyone to see simultaneously. And we're certainly open to any additional ideas, discussion requests around cadence of specific report outs and opportunity for dialogue around those reports. If I could add one more thing briefly, the goal here, we're sunsetting this plan at the end of 2027. So part of what we're trying to do from a strategic planning and performance measurement side is just simply normalize and institutionalize strategic planning so that as we go through the strategy refresh over the course of 2027, it's just part of how we do business in the same way that this committee has and Chair, that you've normalized this annual report process, and it's simply part of how we do business.
Thank you very much. Thank you for normalizing it with us. It's been fun. All right. Any other committee questions or comments on this report? And again, know that if you have questions, take them out to coffee, send them to email. This is not the only venue to do that, but appreciate your willingness to speak and share with us, and we can go on to item 11.
Thank you.
Item 11, from the Director, HR Operations and Talent Acquisition, Department of Human Resources, providing an informational report on how the Department of Human Resources set and achieved its 2025 goals. This item is informational only unless otherwise directed by the committee.
All right. Good afternoon.
Good afternoon.
Introduce yourself. Floor is yours.
Good afternoon, Chairman Supervisors. My name is Claire Miller. I'm the Interim Chief Human Resources Officer. Wanted to introduce myself before my colleague here goes through our PowerPoint, but I'm looking forward to working with this committee and yourselves.
Good afternoon, Mr. Chair and Supervisors. My name is Peter Labonte. I'm a Program Manager in the Department of Human Resources here to present our report. Let me just put it in share. Briefly. All right, there we go. Okay. The Department of Human Resources is the steward of two of Milwaukee County's organizational goals. 1A, which reads reflected full diversity of the county at every level of the county government. And 1B, create and nurture an inclusive culture across the county. In alignment with these goals, the Department of Human Resources has three focus areas, including employee experience, total rewards, and leadership development and support. This slide and subsequent slides provide the results for the measures on HR's scorecard. This chart, for example, provides the breakdown of the diversity of Milwaukee County's employees in comparison to Milwaukee County's population. This is additional segmentation of our workforce, and this slide it provides the breakdown by gender. This slide and the next provide some of the data from HR's talent acquisition team. While not on our departmental scorecard, these results significantly contribute to the overall diversity of the workforce. This slide highlights not only the diversity growth in both applicants and hires, but also provides measures such as time to fill and other operational results of efficiency and effectiveness. This is another visualization of our talent acquisition team results. On the left-hand side of this slide, it represents the number of applicants broken down by the various groups, as you can see on the slide. And on the right-hand side is the number of new hires from 2024 in comparison to 2025. One of the goals on HR's strategic plan and also a measure on its scorecard relates to onboarding. In 2025, we conducted a brief survey of departmental leaders to evaluate the current state of onboarding here at the county. While HR does manage the weekly new employee orientation, or NEO, process, onboarding really occurs at the department level. Our expectation is not to be prescriptive in all aspects of a department's onboarding process, but our goal is to provide guidance on onboarding best practices and to ensure that all departments have a systematic, documented onboarding process. This work is in its early stages and is expected to be completed by 2027. HR also tracks the number of internal promotions within Milwaukee County. We did see a slight increase in the number of promotions from 2024 to 2025. We have a lofty goal here, 10%. We'll continue to monitor this to see if that's achievable. But nonetheless, we know from survey data that having the opportunity to advance is important to our workforce. And measuring internal promotions helps us to understand if the county is providing these opportunities for employees to grow, advance, et cetera. Retention is also a measure on HR scorecard. As you probably know, retention measures the number of employees who stay with the county over a period of time, a quarter, a year, et cetera. And we did see a slight increase in retention from 2024 to 2025, as you can see. Retention is another key indicator of overall employee engagement, satisfaction. If employees are engaged, if they feel included, if they're satisfied, et cetera, they're more likely to remain here employed at the county. Another measure on our scorecard was the compensation transformation project. And this chart indicates the number of eligible families aligned to the new compensation structure. In 2025, this multi-year project was completed. Very exciting. So why is this important to what we're talking about here today? Having aligned job families really lays the foundation for future work related to creating job ladders and lattices and providing pathways, career pathways for employees who want to advance, whether advance in their position or advance sideways, et cetera, within the organization. So we're excited about this work. All right, so those are the measures on our scorecard. Some of the other highlights from 2025, just touch upon a few. Certainly, our talent acquisition team takes a very proactive approach, whether it's hiring events or being out in the community. And as we highlight here, one of our hiring events had 300 folks attend, which is a lot, but we usually get pretty good attendance. 2025, we also had the Into the Streets initiative. You can see the number of employees engaged in that. And that 2026 version happens to be going on this week as well. I'm sure we may talk about that. In 2025, we launched the culture statement, which is really being intentional about what is the culture that we want to help drive engagement, inclusion, improve retention, et cetera. And certainly, participation in training programs has been high, and among other results that you can see on this slide. Looking ahead to this year and beyond, continue to expand and strengthen our talent pipeline. It's important, the folks we bring in, et cetera. We are merging the learning and development and DEI functions within HR into one division that is going to be called Organizational Learning and Culture. Our RPS, our retention team, is always looking at improving their efficiency and effectiveness, upgrading some of their systems. And then later this year, later this summer, early into the fall, we'll be implementing the 2026 Employee Engagement Survey. This will be the county's 6th all-employee survey since 2016, among the other activities that you can see listed there. That concludes our presentation. Joined by other folks, both online and in the room from HR, happy to entertain any questions that you might have.
Thank you. Committee, questions? Vice Chair.
Thank you, Mr. Chair. In regards to, I believe it's the first goal with workforce diversity, or I'm sorry, is that, no, I'm sorry, that might be a separate goal. Or you're tracking workforce diversity, I suppose. I was specifically interested if we're tracking at different levels of workforce, like at position levels, so that we're seeing diversity also throughout, like higher levels of leadership, not just, generally.
Thank you, Chair. Supervisors, Peter Labonte, Program Manager. I can certainly start the response to that, but the answer is yes, we can drill deeper into this data. At a high level, Milwaukee County's workforce certainly represents the diversity of Milwaukee County. When you start to peel back that onion a little bit, it's not, they're certainly, whether it's managerial or other levels, we may not be as diverse as it would look at the macro viewpoint.
Thank you. Questions? Supervisor.
Thank you, Mr. Chairman. My question is surrounding Goal 1, where I see that it takes 67 days to fill a position versus in 2024, it took 68. I see that we got a jump. I believe that's in a positive direction, but I'm trying to understand why it takes 67 days to fill a position. And then also, the average in 2024 for days to contact would be 179 days, I'm assuming, and now it's up to 270. I just want to get an understanding as to why that is.
I can speak, Gennaro Baez, there he is. I don't know, Gennaro, if you want to, Director Baez, if you want to speak to that?
Yes. Good afternoon, Chairman and Board. Gennaro Baez, Director, HR Operations and Talent Acquisition. Relevant to that question, we look at the total number of days, counting the creation of the certified list. A majority of our positions are civil service, and under that construct, where there is defined periods where we post the position, there is a competitive scoring where we compile and get to a requisite number prior to submitting to the hiring manager for review, which takes time. Relevant to the time to fill metric, we also look at involvement from our people managers in the hiring process and looking at their schedules relevant to getting through their lists and making viable decisions for hire. We, in two performance years ago, we did hire a workforce data analyst to help us communicate some of this data regarding the different levels that we hire against and show where we have representation in high-level sole contributor roles and managerial roles against that 1A and that first goal for HR, which is making our workforce be closer to the representative demographics of Milwaukee County.
Would you like to follow up?
Yes, thank you, Mr. Chairman, and thank you, Director. So I heard the workforce data analyst. Was that beneficial? Was that hire beneficial in helping to figure out a solution as to how to get this number to a better average? And again, I'm sorry if my question is confusing. When I say a better average, I just here and understand it's 67 days to fill a position. That's a lot of days having a position open. So I'm trying to understand if the data analyst was beneficial when they got hired 2 years ago, and what's being implemented now to make sure that we reach certain goals. Thank you.
Director, you want to take that one?
Yes, thank you. Yeah, thank you, Chairman and Supervisors. Gennaro Baez, Director, HR Operations and Talent Acquisition. That was a key hire for us because we now have the ability to really have a data-supported argument. There are a lot of disparate data sets that aren't necessarily captured within our applicant tracking system platform, where that overarching data view allows us to bring together those disparate data sets and track things a bit more accurately. Initially, there was also an establishment within talent acquisition of what are the right performance metrics we should be tracking and what are the right key performance indicators we should be tracking in order to get us some of that data representation to see how our performance is. Coupled with that, in coordination with learning and development, we have put together hiring manager toolkits that are very prescriptive with our people managers throughout Milwaukee County and helping guide them along best practices around interviewing, around hiring, and also around selecting a workforce that is representative of that goal. So we've taken that prescriptive path, which ties into the metrics and the numbers you see there, which will hopefully continue to improve.
Thank you. Supervisor?
Thank you. I appreciate that, and yeah, I look forward to having this conversation further.
Thank you. Just to follow up on that, do we have a 2026 goal associated with that item, or is that just still under discussion as to what KPIs will be prioritized for this year? Director, if you want to
take.
Yep, that'd be great.
Sure. Yeah. Gennaro Baez, Director, HR Operations and Talent Acquisition. Chairman and Supervisors, yes, we are constantly taking an iterative approach and looking at our metrics and KPIs. An earlier meeting today, I worked with our CIO to develop some added language for our workforce data analysts to incorporate alignment with IMSD so that there's more collaboration and corroboration on data and having really a single platform of truth where we could accurately capture our performance across the board and tell a story with that data. So part of what will come out of that will be the establishment of refined metrics and KPIs that will, of course, be included in the department's annual reporting.
Thank you. Mr. Terrio.
Thank you, Chairman and Supervisors. Dan Terrio, Director of Diversity, Equity, and Inclusion within the Department of Human Resources. I just wanted to go back to Vice Chair Gomez-Tom's question regarding the workforce diversity. One thing I wanted to mention is that there is an interactive dashboard located on the Milwaukee County website that showcases the racial and gender diversity of Milwaukee County's employees, and you can actually narrow it down by department. So you'll be able to see in real time the racial and gender makeup along with tenure of Milwaukee County's workforce. I will point out that that data is updated quarterly based on the hiring data that is provided from once they go out and self-identify. I also want to point out that the demographics that are listed out there are indicated per the Equal Opportunity Employment Commission, and so it's based off of the reporting that we have to submit in every 2 years to the federal government regarding the racial and gender makeup, along with veteran status and disability status as well. So I just wanted to add that into your question.
Thank you. Any other questions or comments on this report? everyone. Congratulations on the retention, number. That's a big one, right? Increasing. That matters. So it's good to see that employees here want to work here. They're excited to be change makers, and they're sticking around and doing a great job. So, that's a big one. So congrats on that. Okay. We'll go on to the next item. Item 12.
Item 12, County Clerk's Office, Election Commission's Chapter 108 Annual Report for Year 2025. This item is informational only unless otherwise directed by the committee.
And I see Mr. Christensen. Good afternoon. It's been an eventful week, but if we could just probably just stick to the report, that'd be good. We can put that on next year's report. The floor is yours.
Thank you. Thank you. Good afternoon, Mr. Chairman, Supervisors. George Christensen, your Milwaukee County Clerk. Today is a more fun day to report on more fun things such as equity and the healthiness of our county. I'd like once again reaffirm my commitment to and support to supporting the county's vision of achieving racial equity and becoming the healthiest county in Wisconsin. I'll keep it short. I'll follow. I know it's a long day. Well, we had three primary goals, and one was to implement Spanish-speaking closed caption video technology to Milwaukee County Board of Supervisors meetings, and I'm very proud of that, and it's been going very well. Our goal, too, is to grow and retain staff diversity to include culturally competent employees that can provide the highest quality of customer service to all residents. We have consistently maintained bilingual individuals, for example, within the county board legislative aides, my staff up front, the four individuals that have taken marriage licenses, 3 of the 4 are bilingual. I'm very proud of that as well. And so we continue to strive towards having that type of diversity. And then goal 3 is to deliver consistently high quality and accessible and respectful customer service to all members of the public by implementing standardized service practices and regularly requesting customer feedback. We have customer satisfaction surveys, and I'm proud we consistently receive pretty high marks, so I'm proud of that. Within just touching on election commission, our voter outreach and education programs have been consistently helpful in educating the voters on how they can vote without any, hopefully, fear of intimidation or anything like that. And so we'll continue to do that across our great county. With that, I'll turn it back over to this committee for questions. Thank you.
Thank you. Committee, questions or comments on this report? Supervisor.
Thank you, Mr. Chairman. Clerk Christensen, I have a question. I'm just curious. And I'm very thankful that we now have most of our literature, I believe, and engagements offerings in Spanish. Has there been a concerted need, a noted need for Hmong language or any other languages, German or Russian or anything?
Supervisor, thank you for the question. We've looked at that over the past years, and we haven't seen, an overwhelming request for that. It's certainly something we will always look at, but it has come up in the past, just specifically Hmong, quite frankly. Yeah, we haven't seen it in other languages. We do have in-house, for example, my deputy clerk, Stefan Dostanic, he speaks upwards of 5 different languages, and so we're fortunate that way. I'm very proud of that. And we do also have the interpreter telephone system that we use for, I guess, for lack of a better term, more rare languages that are used within Milwaukee County in our service needs. It's something we can always look at, though.
Thank you, sir. I asked the question because I have a significant number among in my district. So thank you so much. I really do appreciate that.
Sure.
Thank you. Any other questions or comments? Seeing and hearing none. I hope you get the weddings going in the courthouse. Yeah. Best wishes with that. And let us know if there's any roadblocks that we need to,
That's certainly somewhere else we're working on. I appreciate that. Yeah, it's been a little bit of a challenge, but we're getting there.
Okay, good. Yeah, and excited to see the voter outreach campaign strategy later on in the year when it's developed. But thank you for the report.
Thank you, Supervisor. Have a great day.
All right, you too. All right, we'll go on to item 13.
Item 13, Clerk of Circuit Court 2025 Annual Report. This item is informational only unless otherwise directed by the committee.
All right. Good afternoon.
Good afternoon. Oh, you're doing it. Okay. Sit down. Okay. Talk about collaboration. That's one of the things that I talk about.
Yeah, that's good.
You see how that works?
Cross-functional, interdepartmental.
Yes,
Great.
exactly. I know you said 5 minutes, but you'd like 2, and I can give you 1. No, I'm just kidding. My name is Anna Hodges. First, good afternoon, Chair and supervisors. I'm Anna Hodges. I'm your Clerk of Circuit Court. With me, I have Wesley McKenzie, who is my Senior Financial Manager. Actually, proud to say I recruited him in from outside. So he's been with us for over a year, still coming to work every day, so we're doing good. It's always interesting when you can get people from the banking area to come in to government, but there we go. So I won't bother you, won't go over. Oh, sorry. Oh, no worries. So I obviously am not going to sit here and read our mission and vision to you, but know that for my office, I envision a court system where all litigants, regardless of identity or representation, are afforded equal procedural justice, equal access, and those types of things. So that's really where I'm focusing. Again, this is the second year that my office has actually participated with strategic planning, which I believe I said last year, I think is important because we're a partner, regardless as to whether or not we happen to hold an elected position. I think we're part of the county at large, and we should be here to support it. For goal 1, it looks a little odd because I identify 4 core areas. You're going to see those pop up for me a lot. I will say that, and that's because with the work that we do in my office, as you know, I'm responsible for maintaining the records of the court, for processing everything that comes in and out of the courts, supporting the community with documents and anything that they might need. So much of what I do is around managing staff, managing people. And so I have a staff, I think rather large staff, not the largest, clearly, but it's a staff of nearly 300 people. And so a lot of what we do is about managing that staff, retaining that staff, keeping that fire within that staff. So you'll see me talk about morale and recognition and those things, and those are core to what I think we need to do. I also talk about improving departmental collaboration with other areas, other offices. And as was represented today, addressing physical silos within the clerk's office, and then access to justice with access within the system, the complex itself. Excuse me. I will say, when we talk about staff recognition and those things, again, it's a staff of about 300 people, and I can say that I think at this point I have 20 open positions. So we've done a really good job at holding the line on keeping our staff, keeping people here, keeping them excited about the work we do. There are always going to be issues, and I know it's been asked of me before in terms of salary. Does that present issues? It absolutely does. But so on our side of things, we do what we can to keep people happy to come here. There are other positions within the county that pay substantially higher than, say, my deputy court clerks, who are our highest level people who are in the courtrooms doing that work with the judges every day. Our paralegals, quite frankly, make more than our deputy court clerks do within the system. So it's really important that we do what we can do to connect with them, know that we appreciate them and their contribution. So that's something we work on real much with. And I think you probably saw in our report, we do all kinds of things. Just for the holiday season alone, I think people were coming and taking pictures of our office because they really get into it, and it's a full-blown competition. So we do what we can to support our staff, is what I'll say. Goal 2, you all have seen those pictures of my horrible evidence room, and the board, and some of you have toured it. And so I have to say, since I submitted my report, you all had already identified some ARPA dollars for me so that I could renovate and get a new evidence room. But due to the new building, the space that I was supposed to get has to be used in order to make everything kind of fall in place. So I'm not started. It has not begun yet. So hopefully next year when I come, I will have an opportunity to let you know and show you some new pictures, and you will no longer be looking at the wet boxes and the crammed spaces. But something has been identified, but it could not take place, so I can't report to you that it's happened. But I will definitely stay on it and trust and believe that everyone that talks to me about it, that's the first thing they hear. Okay. When we talk about collaboration, it's interesting because the clerk's office intersects with so many other departments. They seem to need something from us or some work with us in a lot of ways. So we did last year look at doing some new things with child support enforcement, just trying to look at, could we restructure some things in one of the courtrooms, some on the felony side, to see if we could move people through quicker. Once we got through everything, due to the restrictions within CCAP, we found that it wasn't something necessarily that we could do, but it was really good to have those conversations. We look for I think having those conversations gives us an opportunity to have future conversations. So that may come to pass. What I'm looking at now, quite frankly, is, so again, let me close the book on that. We weren't able to get that far in that process because we just couldn't because of technology, our limitations around technology, but it's something that I think we'll continue to do. I am, however, looking now, well, I don't want to steal my thunder, that's my goal. So let me give you my highlights. So we had a total filing of 113,711 cases. We had 6,300 cases, a little over 6,300 cases, visits, I should say, in the Milwaukee Justice Center, and welcomed about 32,000 jurors here to the courthouse complex. And I did mention the position from the navigator from downstairs because I did take that position on. It's still there and it's fully funded, so there'll be no issue in the future with that going anywhere. So when we look at 2026 in terms of our highlights, we're going to continue to focus on those 4 core at the beginning because I think that's really important based on, again, managing a large staff. I think it's important to stay focused on those things in terms of keeping people here. But we're also looking at engaging in conversations with the Sheriff's Department and the CRC because we intersect there, and there's documentation that they need as well. So we're looking at doing some automation, which will save people having to come and get documents and those kinds of things. So that's something we're working with CCAP on to see if we can automate on our side so that we can send documents to them. So just a little something that we're going to try to work out, and that will cut down on a lot of stress for them, and hopefully, and maybe even some man hours on their side of things. And then number 2, I skipped over, but that again is our exhibit room and getting our staff addressed that are over in the safety building. We do have some environmental questions over there, so I'd really like to get my staff out of there as soon as possible, and that's something that's on the forefront. And that's it.
Thank you very much.
Okay.
Committee, questions or comments? Supervisor.
Thank you, Mr. Chairman. Thank you for being here as well. I saw in goal 1 that one of the main goals, strategic plan goals, was to increase staff morale and recognition. And I'm just curious as to what's been done so far to get that ball rolling.
Okay, so since we, of course, we are not in a position where we can give merit increases in those things. We do a lot of morale boosters, I should say. So we do a lot around holidays. We do things, they just did a big Mother's Day brunch in the office. We've just kind of tried to acknowledge those special holidays for staff, and give them the opportunity to kind of support and celebrate each other. In terms of the management staff, they spend a considerable amount of time trying to learn their staff and respecting who they are. And I think that those relationships that are being built are really the thing that's keeping people here. So it's not any one thing. I think it's just trying to support people in total, as a total person, not just someone here from 8 to 5.
Thank you. Thank you.
Thank you. Any other questions or comments? Before you go, I know we talked a little bit over email, but just wanted to, I guess first on the ARPA item, and I don't know if this is for you or maybe the comptroller, maybe just afterwards. I don't know if we need to reallocate the ARPA funds because I think those need to be spent by the end of this year. So I just want to make sure that.
That's already been addressed.
It's already been addressed?
Yes.
Okay, great, cool. Then the only other thing is, I know we talked a little bit about just once Supervisor O'Connor and I went to this Marquette Law School presentation about the lack of diversity in our jury pools, as so often can happen, and just are there strategies either that the county board or private entities can be doing to change that, right? Are certain things like set in statute, or are they just sort of like the way we've always done it, and can they be done differently? So I would love to just sit down and we don't have to chat about it today, but I would love to be able to just sit down and just chat through some of those things. I'm sure you would too. So if you're up for that, that would be awesome.
Oh, absolutely, absolutely. I did send back a response.
Yeah, right.
But, there's some things that we can do, other things we need to be a little bit cautious about.
Yep.
In terms of the diversity in total, our numbers are off a hair. We've gained a lot, I have to say.
Okay.
At one point, I think we were looking at, our response rate was something like 19-20% amongst African Americans in particular. And now I think census has us at about 36%, and we have a 34, and we have a return rate of 32. So we've gained quite a bit, but that's not to say that's not enough. I mean, we still want to do more. I will say that because of the number of juries we have coming through, I also had to increase the list. We're going to tell you, I was telling you I get a list from DOT. I increased that by another 25,000, and because we just needed more people. We would get to the end of the year and start running low on potential names. So I'm thinking, my feeling is that because now we have a wider net, that we're probably, hopefully, going to experience a bit more on that side too. But we can definitely talk whenever you like.
That's great. That's all great news. Cool. Yeah, and then the last thing we talked about, and I just see, because DHHS director is here too, one of the things we talked about over email was just, we've got this captive audience when you're in a jury and you're just sitting there, right? And you're like, oh my God, right? So you've got 7 hours that you could learn literally everything about Milwaukee County. You could learn about every resource in Milwaukee County. I just think it's such an opportunity if we could take advantage of it, because I think folks are coming back here every, 4 years to do jury service, theoretically. And what an opportunity, to me, that room is just like, we could be talking about the resources we have available, or the opportunities we have for service, or yada, yada. So would love to explore that more too.
Yeah, actually, the director and I have already had that
Okay, great.
conversation.
Excellent.
So thank you.
Excellent. Okay. That's amazing. All right. Any other questions or comments? Amazing.
All right,
Thank you.
Thank you.
Oh, there you go. So you know exactly what I'm talking about. Yeah. We'll go on to item 14.
Item 14, Medical Examiner's Office 2025 Annual Report. This item is informational only unless otherwise directed by the committee.
Good afternoon. Welcome back. Welcome back to the room.
Good afternoon, Mr. Chairman and supervisors. I'm Dr. Wiesława Tłomak, the Chief Medical Examiner for Milwaukee County Medical Examiner's Office. With me is Milwaukee County Medical Examiner's Office Operations Manager, Mr. Timothy Szabo. The next one. Milwaukee County Medical Examiner's Office investigates sudden, unexplained, and violent deaths in Milwaukee County as outlined in Wisconsin state statutes. According to the 2020 United States Census, Milwaukee County has a population of approximately 940,000. The racial and ethnic composition is approximately as follows: 55% white, 30% Black or African American, 15% Hispanic and Latino, 4% Asian, less than 1% Native American, and 2% other. Death investigations in Milwaukee County serve Death investigations in Milwaukee County serve all citizens, including those in historically underserved, marginalized, and or adversely affected groups. In 2025, 8,470 deaths, which is 90% of the total number of deaths in Milwaukee County, were reported to the medical examiner's office. Our forensic pathologist conducted 1,727 autopsies and 125 external exams. They signed 2,177 death certificates. The office conducted cremation views and issued 4,002 cremation permits. Our mission statement is reflected in our daily operations. Our goals align with national standards for forensic death investigation, with a strong emphasis on professionalism, accuracy, and community service. The Medical Examiner Office goals in 2025 reflected our strategic plan, with focuses on improving employee well-being, breaking down medical examiner office silos, and driving upstream investments through data. Our first goal was achieve full accreditation for the medical examiner's office and toxicology laboratory. The biggest factor that enabled our department to accomplish this goal was being fully staffed and having additional positions funded through the Opioid Settlement Fund. The Medical Examiner Office has been either fully or provisionally accredited by the National Association of Medical Examiners for 26 years. In 2024 and 2025, the office received full accreditation. I'm happy to report that I submitted the annual accreditation report on March 13th, and by the end of March, the office was approved for continued full accreditation. We will have an on-site visit next year. The Medical Examiner Office Toxicology Laboratory underwent on-site accreditation visit by the National Accreditation Board in September of 2024. By the end of 2024, the laboratory fulfilled accreditation requirements of International Organization for Standardization in forensic testing and calibration in the field of forensic testing. In order to maintain certification, the laboratory undergoes annual reviews. The review was done in 2025, and the lab remains fully accredited. Our second goal was to create partnership with local epidemiologists to provide data that can be used by other agencies. Unfortunately, we were not able to establish this partnership in 2025. However, I have a meeting coming in the next few weeks with an epidemiologist who works at the Medical College of Wisconsin. The office collaborates with the Medical College of Wisconsin Comprehensive Injury Center, Overdose Public Health and Safety Team, Violent Response Public Health and Safety Team, as well as our pathologists participate in different death reviews on the state and county level. The Medical Examiner Office has been providing fatality data for Milwaukee County Motor Vehicle Crash Dashboard and opioid overdose dashboard. Our third goal concentrates on retaining our employees, and the goal is to maintain competitive compensation for investigative and autopsy staff within 10% of Hennepin County Medical Examiner's Office in Minnesota. Why Hennepin County? Based on data from the National Association of Medical Examiners, the Hennepin County Medical Examiner's Office in Minnesota serves a similar population and handles a comparable case mix. As both jurisdictions are located in the Midwest, cost of living considerations are also comparable. Compensation for medical examiner's office employees has been reviewed as part of the Milwaukee County Compensation Transformation Project. As a result of the Compensation Transformation Project, combined with proactive decisions by department leadership, the medical examiner's office successfully achieved its target benchmark in 2025 of maintaining compensation within 10% of Hennepin County. Our next goal is to increase the number of employees attending continuous education seminars annually. There is a progress in medical sciences, and it does not exclude forensic medicine. I strongly encourage my colleagues to attend national, regional, and regional conferences. In 2025, Medical Examiner's Office continued to prioritize professional development. The office supports ongoing learning through monthly in-service lectures held on the third Thursday of each month. Those lectures are offered both in person and via Teams to ensure accessibility for all shifts. The sessions feature a range of topics in medical legal death investigation and are led by internal staff as well as invited experts. Our forensic pathologists participated in annual meetings of the American Academy of Forensic Sciences and National Association of Medical Examiners. Our medical legal death investigators were able to attend semi-annual meetings of the Wisconsin Association of Medical Examiners and Coroners, and the toxicology staff was able to attend Midwest Toxicology Collaborative Grant Runs as well as national meetings. Our goal 5 is to promote positive working relationship by increasing departmental sponsored activities with a goal of 6 activities annually. Although our daily operations are extremely busy, we are trying to find some time to communicate with each other and interact with each other. Some of the activities include holiday parties, office luncheons, themed potluck events, and our staff really enjoys it and try to participate if possible. In addition, we have a new management system. The system went live in the middle of January. We are using a Forensic Advantage for medical legal death investigation and Clinisys for the toxicology lab, as well as we have a full financial integration with Inford. I'm very happy to report that I was able to hire an amazing operations manager who is accompanying me today, as well as medical records coordinator. The office conducted 456 examinations for outside jurisdictions, including Kenosha, Racine, Jefferson, Outagamie, Ozaukee, and recently we added Washington County. Being full-staffed allows us to decrease the turnaround time. The average time to complete autopsy protocol and sign the death certificate is 49 days. We are happy to announce that very soon we will be moving to the new facility located on Medical College of Wisconsin campus. We will have a state-of-the-art technology, including a CT scan. Also, thanks to our operations manager, we implemented a new financial policy for delinquent funeral homes, and it will help us to improve revenue collection. Our office cooperates with different agencies. We are, I think, the only office in the Midwest that still has toxicology lab, and we are talking with other medical examiners in Wisconsin and encouraging them to send toxicology specimens to our lab. Our focus is on maintaining adequate staffing to continue providing timely and accurate results and data. This concludes my presentation, and we will be happy to answer your questions.
Thank you. Committee, questions or comments? Go ahead.
Thank you, Mr. Chairman, and thank you, Director. You mentioned that Milwaukee County has a toxicology lab where others may not. I find that interesting. According from my background, I find that very interesting. Do we know why that is? The lab was established before I joined medical examiner's office in Milwaukee. With some medical examiner's office, because of financial problems, they decided to close their labs. With our lab, I think that I'm excited that we have it. It helps our doctors to have the lab next door if we have any questions regarding toxicology report. In addition, our office has a forensic fellowship program, and the program is accredited by Accreditation Council for Graduate Medical Education, and one of the requirements is to have toxicology rotation. So our fellow can rotate through our lab. We also have fellows from medical college who also rotate through our lab.
Yeah, right.
I'm glad to hear the MCW sending their fellows there. Are we getting fellows from Madison or other?
Not yet, not yet, but we are talking about coexisting with medical college on their campus. There is a lot of projects that we are discussing. And in addition, our lab conducts testing for University of North Dakota, and a team is working on another agreement, and hopefully in the close future, North Dakota will be sending their toxicology specimens to our lab.
Beautiful, thank you. think it's time for a field trip.
Definitely. It's unfortunately our moving date just moved a little bit, but when we operate in the new building, I would like to invite you for a tour. It's beautiful.
All right, thank you.
Thank you. Thank you. Any other questions or comments? Seeing and hearing none. Thank you very much.
Thank you.
We'll go on to the next reports. Item 15.
Item 15, OEM 2025 Annual Report. This item is informational only unless otherwise directed by the committee.
Amazing. Good afternoon, Director. The floor is yours.
Afternoon, Mr. Chair. Give me a second here. I'm getting settled. I'm flying solo, so I have to do my AV as well. Thank you all for coming. I'm Executive Director Cassandra Lieber with the Office of Emergency Management. With your permission, I'll share my screen.
Go ahead.
Thank you. Okay, again, Cassandra Lieber, the Executive Director of Office of Emergency Management. And many of you are aware, but I'll share here that the Office of Emergency Management holds 4 distinct divisions, one being 911 communications for our Sheriff Department. Also, we oversee radio operations for all of the radios throughout the county. And then we provide medical direction for our EMS team. We've had lots of partnerships there. Then we also oversee emergency management, hence the name. So those are the 4 departments that make up OEM. And of our strategic plan, we have 3 key factors that we look into, and it's building organizational strength, increasing partnerships, and maximizing the use of data and technology. And our scorecard and goal align with that. So as I talk about our annual report, we'll see those alignments fall into place. But our 3 scorecard items are answer 911 calls in a timely fashion. It's 10 seconds. We've met that and exceeded that goal over the years consistently. We're also looking to establish outreach initiatives. Here we kept it at a 1 at a time, but the work that we do, we cannot do alone. So we have a lot of built-in outreaches, but we're trying to expand on that on a regular basis. And some of that is situational, that we look at different situations. If you think about things that we have been involved in over the last few years, from COVID to RNC, DNC, to the championships. So we work with partners across all of those different avenues. Most recently, we had the flooding, so we work closely with FEMA in the state as well. So just some of those collaborations. So when we say we're looking at outreaches, that's in addition to just the stuff that we have to do to get the work that we need to get done. And then as part of that, we are working to establish what we call a CIMP. It's the Comprehensive Emergency Management Plan, which basically is across the entirety of the county, coming up with a framework for how we can engage with our municipal partners to deal with situations as they come up. So kind of who's responsible for what respecting home rule, making sure that we adhere to all of that, but definitely ways that we can kind of set a standard of practice that we move forward with when we deal with partners across the county. So again, our goals closely align with our strategic plan, so increasing partnerships and outreach efforts. The flood kind of ties into this because we utilize what we call our corporation, organizations, and active disaster. And so that was a very good partnership that we already had established when the flood came. So we were able to tie into those nonprofits, municipal partners, public-private partners, and just really lean into like how can we help out people when it comes to that immediacy of the event and then dealing with long-term recovery as well. So we work very closely with our state partners to deal with those outreach efforts. And so we were that framework was already in place, and we leaned heavily into that with the storm. Again, increasing partnerships, not only externally, but internally. We expanded our 911 services, started this year. The work has been going on for several years, but in partnership with the Airport Fire Department, just handling their fire dispatching and helping them coordinate their response calls at the airport. This opens up avenues for us to work with other fire departments across the municipality. So again, just laying those groundwork, there's always like building blocks upon what we do. Our third is upgrading communications infrastructures. Again, we manage 911 communications as well as radio support and antennas for the municipalities across the Sheriff Department and municipalities across the county. And we're constantly looking for opportunities to make sure that we have the best equipment, the best technology that's available for us that we can afford. Just really finding ways that we can connect. So working with our vendor, Motorola, we were able to develop a unique interoperable platform for radio communications that developed between Milwaukee County and Waukesha. That's where it started. It's already expanding into Racine, and we're having conversations with Madison as well. So again, just spreading that footprint across the state so that when these incidents happen, mutual aid is a lot easier to facilitate because we already have those frameworks in place. And then our fourth goal, again, increasing communication efficiency. This ties into our IT maximization. Again, where can we communicate with other municipalities to say, hey, look, if an event comes up, how do we keep that communication bridge going? Again, hearkening back to the flood, we had lots of people in the community. FEMA came in from Chicago. We had people coming in from different areas coming in and talking and having to be out in the community. So then how do we stay in touch with them? You know, we can, phone calls are possible, but not the most efficient way. And then also just maintaining security purposes, having that line of communication. So again, we're constantly building on those opportunities. So we've made lots of infrastructure investments within our radio and 911 systems. Again, not to harken too much on the flood, but it was one of the things that when we talk about goals and opportunities, it was a little bit of both, and it also was some challenges. The staff that I have dedicated to emergency management is a small but mighty team, and I have to say, in terms of collaborations across the county, my fellow cabinet members and other parties were very, very instrumental in helping us out, leaning in, helping out where they can. Everyone reached out and said, what do you need? How can we help? So that was really useful for us. And then that, because of the work that we did, like we have built in, like I said, I have the emergency management team, small team, but I have the EMS team. Our EMS team works heavily with data. And so part of that team just naturally transitioned into how do we document flood damage. So we started putting together dashboards. We started to put together maps and using our GIS coordinator to start putting things in a visualization so that when we went to the state and then additionally on to the federal partners, we were able to showcase that information very quickly. So that was instrumental in making that process go a lot quicker because we were able to say, this is a distinct picture of what the community looks like and where we're seeing the damage. So where you guys can go and do assessments, we were able to pinpoint a lot of that because of the framework that existed for EMS. We were able to transition into the flood. And as a result, we obviously saw a significant amount of FEMA funding come into our community partners in civilian-wise, but not so much on the public access part, but we're always having those communications across the board on what we can do and how we can engage our partners in ways to increase efficiencies. So. And then other highlights for 2024, we transitioned into 25, and then now expanding into 26 is our whole blood program. This is a program where we can provide blood infusions in the field, and it's the first of its kind in Wisconsin. There's no other entity in Wisconsin that does this. Ironically, when we launched this, within a week, ironically, it was on Chicago Fire show. So they were like, oh, in Milwaukee, they're doing a thing. And we're like, yes, we are. And so, so our blood program is, state of the art. It's a lot of collaboration with university and with the medical colleges and with the fire departments as well, just how we reach out and get this blood out into the field. And just statistically, a lot of what we do isn't really measurable because it's partnerships, it's relationships, it's anecdotal. But in this instance, we started out, we were reaching about 45% of the population, and we look at things in terms of like survivability of, injuries and things like that. So we were starting out, we were hitting about 45. We've increased now to about 64% of the population that meets the criteria that is able to get this blood. And that has resulted in a positive of 36 adult patients have survived their injuries because of the blood infusion programs. We also had 4 children who were able to receive blood in the field and be able to have positive results. So this is a great program. We anticipate expanding it. My team is at a conference right now just speaking of the work that we're doing, opportunities like opioid funding, ARPA funding, CARES Act even back, has helped us kind of move these things along, but there's always opportunities and we're always looking for ways to expand on those. And then looking forward, my colleague already talked about our new facility. We are super excited about that location because currently I operate out of 2 separate locations. Administratively, we're on Wisconsin Avenue, and then in terms of 911 and radio, we're at the safety building. So just from a team building perspective, it's very challenging to see like, oh, half of your team lives in this nice, clean building, and half of your team lives in the safety building, and then you're over there and we're over here. So this creates an opportunity for us to be in the same space. So morale building, many of my colleagues talked about that. This is a great opportunity for that, but also a great opportunity for collaborations like Dr. Talomic talked about. We have ongoing conversations with MCW, ongoing conversations with them in the state crime lab. So great opportunity for collaboration. We look at expanding that. And as we speak, my team is currently moving into the space partially. We're still working on some 911 stuff, but hopefully, again, by the summer, we should be fully engaged in that space. And by all means, we'll be extending invitations for you all to come. But that is all I have. I'm open for questions and any additional information if you need.
Very much. Questions, comments? Vice Chair.
Thank you, Mr. Chair. I just want to continue to applaud the work that you all do. I get to see it firsthand, chairing the Emergency Medical Services Council, but it's always just really fantastic to see all that comes together collectively at the county, but also across municipalities. So thank you.
Thank you.
Supervisor.
Thank you, Mr. Chairman. In regards to the dispatch operations, are there any understaffing issues, keeping staff, keeping morale up, and retention, all of that good stuff?
Thank you for that question. That is also always a challenge. The work that we do is very challenging. Not only it's 24/7 operations, but the work is challenging emotionally. It's very stressful. We deal with high stress situations. So yes, retention is hard. Pay is always a challenge. And then one of the things that we experience within Milwaukee County is because of the structure of how municipalities are set up, the 911 centers, many municipalities have their own 911 centers, so it's kind of disjointed right now. We're working with partners trying to encourage them to find some collaborations and opportunities there, but we then become in competition with our peers, and so that also creates a staffing challenge as well. But thank you for that question.
Yeah, go ahead.
Another question in regards to the challenges for the dispatchers. How are we doing anything, or how are we helping to assist them and facilitate them with behavioral health or their mental wellness? Is there anything that we're doing to help keep them I can't imagine. I just can't imagine being on that call center and the things that they have to deal with on a daily basis.
Again, thank you for that question as well. Yes, some of the things, like me and my colleagues talked about, we do morale building things just to keep them engaged. But we also work with the Sheriff Department. They have a contract that allows us to bring in and refer people beyond EAP to psychological services. So that is something that we encourage them to participate in as much as possible. And within our facility, we also have built-in quiet rooms so that when they need to step away and take a break, they can step away and do that. So we have spaces at our current location and at our new location where they can step away off the floor and just disengage when they need to catch their breath or just to reset. So we're allowing that at our current location and at our new.
Thank you. I yield back.
Thank you. Okay, Supervisor.
Thank you, Mr. Chairman. Thank you, Director. Piggybacking on Supervisor Martin's question about health and wellness, and I appreciate you saying that there are quiet rooms and, taking a moment to be able to reset. And again, this work is really difficult. So again, I do thank you and your teams for your service. And I just want to follow up and ask, in addition to the quiet rooms, are there any professional development trainings or anything like that that are in the works or possibly ongoing to make sure that although we're recognizing that if you need a quiet moment, but knowing that this is a job to where you're getting a lot of things dumped on you daily? And is there a way for people to really cleanse their minds or cleanse their thought processes before they actually leave the building, like as speaking to someone or just having a regular dialogue with coworkers on how their day went so that they can decompress before they go home?
Thank you for that question. Some of the things we are working, it's a work in progress, is the short answer. As we have the new facility, it creates a lot of opportunities. So some of the things that we are talking about with our leadership team is just building in family engagement so that, we have this beautiful new location. They have very important jobs, and sometimes it's good to just share that with your family. So creating opportunities for them to have those kind of bring your kid to work kind of environments where they can see that. But then looking at team building opportunities, I just talked with my 911 leadership team, and I said, I want to do team building with them, but I don't want it to be like a canned tree, ropes course or things like that. I really want them to kind of let me know, like, what do they want to do? And what can we get out in the community to do, whether it be outreach or whether it be like a volunteer. Like they've done food drives and things like that where they can go, go and support. We just did Blue Jeans Day, Denim Day, and so things like that where they can show that they are also reaching out to the community and feel good about the work that they're doing.
Thank you, Mr. Chair.
Thank you. Any other questions or comments? I'll just say on behalf of the good people of Wauwatosa, thank you for all the, compilation of all of our damage and at least getting the individuals. So many people in my neck of the woods were impacted, and I know across the county, but especially in Wauwatosa, there was a ton of damage. So just, thank you for getting those funds to get delivered from FEMA, and, I appreciate the report.
All right, thank you so much.
Float down the river. If belongs in somebody's house.
Yeah, there was a lot of.
I can't imagine.
Yeah, that was an interesting day. All right, we'll move on to item 16.
Item 16, a report from the Executive Director, Department of Health and Human Services, requesting authorization to correct a price per meal amount for Jimbo's Lodge Catering, LLC, a caterer which supports the Senior Nutrition Program from January 1, 2026 through December 31, 2026. This item was referred to this committee for informational purposes only and was also referred to the Committee on Finance.
Director.
Hello, everyone. Shakita LeGrant McClain, Executive Director, Department of Health and Human Services. Mr. Chair, Supervisors, thank you for having me today. So this report, we did bring this report to you, Resolution 525-745 in the December cycle for the Jimbo's Lodge Catering LLC. And at that time, we had the rate at $6.25. So this report is just to correct that amount to $6.50 for the term of January 1st, 2026 through December 31st of 2026. And if you have additional questions, we do have Galen Resky on the line to answer those questions.
Thank you. Committee, motions, questions? Oh, is it just information for us, right?
It's just information.
Okay. My apologies. Thank you. Any questions? All right. Thank you very much.
You're welcome.
I'll go on to item 17.
Item 17, a report from the Executive Director, Department of Health and Human Services, requesting authorization to execute a contract with the Wisconsin Department of Health Services to operate the Aging and Disability Resource Center for the period of January 1, 2026 through December 31, 2026, and to accept $7,363,051 in revenue. This item was referred to this committee for informational purposes only and has also been referred to the Committee on Finance.
Thank you, Mr. Chair. Supervisor, Shakita LeGrant McClain, Executive Director, Department of Health and Human Services, and I have with me the ADRC Director, Becky Schmidt, so she'll be here to answer any questions. But we are before you just to ask for authorization to enter into the contract with Wisconsin Department of Health Services to operate our Aging and Disability Resource Center, which we like to call our one-stop shop for ages 18 and older, individuals with disabilities and older adults. And that contract amount is $7,363,051 for the time period of January 1st, 2026 to December 31st of 2026. If you have any questions, we're available to answer those.
Thank you. Questions?
Thank you, Mr. Chair. I just wanted to confirm that this is like our expected regular contract that we have with the Department of Health Services, and just wanting to know if there's any changes or anything crazy that we need to be looking out for.
Absolutely. Good afternoon, Director, Chairman Rolland and supervisors. I'm Director Rebecca Schmidt of the Milwaukee County ADRC. You're absolutely correct. This is not a significant change. I think we received about $125,000 more than last year. This is a very stable contract from the state of Wisconsin coming out of their GPR. And it represents about half of our budget for the ADRC. The other half is Medicaid match. So, yep, there hasn't been a significant change, and we're very blessed to have a stable budget.
Thank you very much.
Thank you. Something stable. That's nice.
Yes.
Yeah.
A little more?
Yeah, right, yeah. All right, seeing and hearing no other comments, we can go on to the next item. Thank you very much.
Thank you.
Item 18, a report from the Executive Director, Department of Health and Human Services, providing an informational informational update on the 2026 state-county contract spending controls. This item is informational only unless otherwise directed by the committee.
Good afternoon.
Good afternoon, Mr. Chair and members of the committee. I'm Claire O'Brien. I'm the Budget and Policy Director for the Department of Health and Human Services. And I have two things I hope you'll want to hear. One, I will be brief, and I have good news to share. So I'm just providing an update on our 2026 state-county social services contract with the State Department of Health Services for calendar year 2026. This contract is a revenue reimbursement contract that provides about $65 million. It supports many of our programs and services across our department. And if you may recall, I've been to this committee a few times previously this year, providing an update on spending controls that the state put into place in response to federal funding uncertainty. So the good news is that the state did receive the notice of funding award for the balance of this year. So this is particularly important, especially to our aging services and behavioral health services. So those spending controls have now been lifted. And the spending controls that were in place for aging services and mental health services were the most stringent controls. So I'm happy to report that, and I just wanted to make sure I circled back with all of you, and I can take any questions that you may have.
Thank you. Questions? Well, good news. 2 in a row. More than 2 in a row. I mean, it's been a lot of good news today. All right. Thank you very much. We can go to the next item.
Item 19, from the Director, Department of Health and Human Services, providing an informational report regarding the implementation of a secured residential care center for children and youth in Milwaukee County under 2017 Wisconsin Act 185 and commitments in the State of Wisconsin Division of Juvenile Corrections. This item is informational only unless otherwise directed by the committee.
All right. And I see Director, or should I go to Administrator Pethke?
Yeah, okay.
Great.
Good
afternoon.
Yep. Good afternoon, Mr. Chair and Supervisors. Kelly Pepke, Administrator for Children, Youth, and Family Services. So before you is our quarterly update on the number of kids who have been court-ordered to the Department of Corrections, Division of Juvenile Corrections, as well as an update on our local Milwaukee County Center for Youth, which is our CERC. So since this report was submitted, those were the numbers at the time of the report. Obviously, as a report, every time these numbers change, they can change by the day. So I do want to just report first out on the number of kids who have been court ordered to corrections. As of today, we have 2 girls who are at Copper Lake. We have a total of 41 boys at Lincoln Hills. Of those, 13 kids are on a regular correctional order, and then I believe there's 28 or so on a serious juvenile offender court order. And again, those are kids who we're not fiscally responsible for paying for those placements, but they are still our kids, so we do track that and monitor that as well. And then we have 3 kids who are at Mendota on a regular correctional court order and 8 who are there on an SJO order. And so far this month, we have had 3 kids who have been court ordered to the Department of Corrections. Of those, 2 of those are on SJO orders and 1 is on a regular correctional order. Overall, just trends do continue to go down as far as the number of kids who are court ordered to corrections. And that has been the case since back in 2015. And there's a chart on the 3rd page that kind of shows that decrease over time. And so with that, just a quick update on our Milwaukee County Center for Youth. We did officially open on March 31st of this year. We had our opening celebration at that point. At the time that we opened, we had 12 kids who had transitioned from our post-dispositional program of MCAP into the CIRCE. And since that time, we are now up to 27 kids who are in the Milwaukee County Center for Youth. Again, these are kids who are all court-ordered to be in this placement, and all of these kids are considered to be on a correctional placement as well. And so of the 27 kids, all of them are boys. We are not currently serving girls in the CIRCE. We have not had any that have been ordered, but also we continue to work with the state of Wisconsin, the Legislative Audit Bureau, around the operating losses for serving girls. That is part of Act 185, but it is part of the act. It's never actually been discussed, or there's no protocol or process in place to how that reimbursement would happen. So it is something we've continued to work on for several months, and we are making progress. It's just a little bit slower progress. We haven't needed to serve girls yet, but we are still open to that, and we'd like to have that as an option so that we can serve any kid who would be in need of a correctional placement here in Milwaukee County. Another part of the whole correctional continuum is the Racine County CIRCE. As of today, we do have 6 kids who are in the Racine County CIRCE. And these are all 6 of those kids had been placed in Racine prior to the opening of our CIRCE. So since we have opened our Milwaukee County Center for Youth, we have not had any kids that have gone to Racine at this point. And with that, I'd be happy to take any questions. Thank you.
Thank you. Committee, questions? Supervisor.
Thank you, Mr. Chairman. Now we see why we needed the contract for Racine. We are not built to house so many youths. But one question that was presented to me at one of my have coffee with the supervisors in regards to the Youth in Our Care dashboard, the community, thank you all for that. They really like seeing this, but they're curious about the rates because they want to be able to calculate how much money we're spending on incarcerating youth and housing youth in these secured facilities versus, if at all possible, recommending other types of placements, in particular like Mendota for a treatment facility. I don't know how many youth facilities are available. I don't know why I don't know that number. I should know that. Anywho. So is there any possibility we can have some type of formula that they're able to do some type of calculation, even though it doesn't really show us how many days a youth is at a particular facility, does it?
Mr. Chair and Supervisors, the Youth in Care dashboard does not show how long a kid has been there. It is really just a point-in-time snapshot of how many kids are in each correctional facility at that time. As far as the daily rates, I can't remember if we have the daily rates listed on there. I can double check. The daily rate for a correctional placement right now is still $12.68 per day. Mm-hmm. The daily rate for Racine is around $1,200 per day. And then Kids in Our Care, we don't obviously charge ourselves a daily. We don't have necessarily a daily rate for Kids in Our Care. We do know what it costs, though. I don't have that number with me right now, but that's something we could take that back and look at the dashboard and see if there's a way to show some of those additional details. But I'd have to take it back to our technology and data team.
Yeah, that's something we can talk about further down the road, and I don't know if we can do something like that quarterly. It's just too labor intensive to do it daily, weekly, monthly, but I would say quarterly, just to give our taxpayers some idea of where their dollars are going, because that is one of the number one questions, I'm sure, across all districts, exactly where is our money going? And so if we can give them something to show them this is one of the areas where we spend an awful lot of dollars, and then maybe state legislators, you would be willing to invest in education, in other programs rather than in incarceration. Thank you, and I yield back.
Thank you. Administrators, you have anything to add, or?
Yeah, Mr. Chair and Supervisors, I will just add we'll definitely look into what we can do quarterly, maybe more often. I will say the daily rate for Milwaukee County is significantly less. I think we're around $900 a day with all of our costs. I do also want to highlight the correctional rate. That's what it is right now, but it is subject to change, obviously, with the state budget. And that is something we continue to advocate for, to keep the daily rate as low as possible, because as that increases, that impacts everything that we're able to do within CYFS as far as anything related to prevention and being able to invest upstream. So thank you.
Okay.
Thank you, Mr. Chairman. Just wanted to add one thing, additional comment. Working with Director LeGrant McLean, Deputy Director Muhammad, and Kelly Pithke and their entire team on this dashboard, as well as just all the other projects that we're doing. It's nice to work with people who, one, are knowledgeable, but most importantly, who has the heart and passion for the work that you all do, and to do it authentically and honestly. Yes, those are two different things. Honestly, and actually have not only the youth, but their entire family structure at the center of what you all present to us, and all the work that you do and the travel that you do to ensure that we're taking care of youth as well as adults in our care. I really do appreciate you all, and I didn't want this moment to go by without my acknowledging the work that you all do and what you all bring to the table, because I know I give you heck sometimes, but I just want to make sure you get your kudos and your flowers in public spaces. Thank you.
Thank you. Any other questions or comments? Seeing and hearing none, thank you very much for the report. We'll go on to item 20.
Item 20, e-comments submitted to the Committee on Health Equity, Human Needs, and Strategic Planning via the County Legislative Information Center. Click.
I took a look earlier. Yeah, we don't have any e-comments, so if there are added later, they'll be appended to the file. But otherwise, that brings us to the end. Thanks, everybody, for being here. We are adjourned.